I'm Dr. Muntu Davis, County Health Officer for Los Angeles County. Well, the resources I personally rely on to stay current, especially in this time of changing recommendations and so many different organizations, is actually two places. One is the state of California, so the California Department of Public Health, who's taken some really good steps, in light of what's come out of the Health and Human Services as well as ACIP, that are changes from what we've normally seen related on evidence. So I usually rely with CDPH and then our own public health department, Los Angeles County Department of Public Health. So providers, when they're seeing patients, in order to access resources, really I'd say referring to the local public health department, so Los Angeles County Department of Public Health, often has the most updated recommendations and guidance, including different things to watch out for and when to report, and how to report diseases that they may run into. Also, the California Department of Public Health has some good public-friendly material related to lots of different recommendations and guidance as well. Well, when I think about larger organizations, national, like the World Health Organizations and others, professional organizations as well, they really do help to give a broad overview, especially if it's international, but we often have to rely on what's happening locally. Now, professional organizations are usually going to be very specific for certain groups or certain specialties, and so it's very important that they keep their members and their providers up to date, so they often have perfect information for the group that it serves. And in general, looking at what's happening locally. So again, looking at your local health department or even your state health department is also important to understand how it might be different depending on where you are. So I think providers, in terms of using their EMRs and alerts that are within that system, definitely a good trigger. When you're busy, you're looking at everything, you're trying to assess all the information. It's nice to have a trigger to remind you if something hasn't been done. So setting up those things to really know when people have not met recommended standard of practice is really important and helps save time as you see patients. How to filter through information overload, that's always going to be a challenge. I think it really is a question of what are you trying to answer, really understanding that question. And if you don't understand the issue, focus in on trying to understand the issue, and then you'll figure out your questions related to that. So maybe not always taking in everything that you've heard, but really focusing in on what you're dealing with and what you need to understand in terms of framing it for patients or even for yourself as you think about how you want to manage it. So as an African-American physician, trained in family medicine, with lots of experience seeing patients and also working in the public health department in Los Angeles County, I often get the question of what do I tell African-Americans and even other people of color related to vaccinations. And one of the things I tell people is really understand what the vaccine is for. Understand that it's not only protecting you, but it's also protecting the folks around you. And so also understand what's happening in your communities. And if there's a high risk, and definitely if you don't want the burden of having a serious illness related to something that you could potentially prevent, then ask questions about what you can do to protect yourself.